You wake up once, twice, or even 3 times in the early morning, and the next day is hell. The quality of your sleep has crumbled, forcing you to spend the day dragging a fatigue that doesn't allow you to concentrate at work, enjoy your grandchildren, or even take a simple walk. You panic about finding a bathroom when you're away from home. You feel that sudden urgency, almost painful, that forces you to run. And despite all that hurry, you only manage to release a weak, intermittent stream that makes you feel you never finish emptying your bladder completely. Your intimate life, that part so vital to your identity, has become a source of shame and frustration, where the fear of physical discomfort overcomes the desire for connection. If you've answered yes, even to just one of these situations, stop. Stop for a moment and take a deep breath. I want you to know that I understand not just what you feel, but the desperation and loneliness that benign prostatic hyperplasia generates, along with all the lower urinary tract symptoms. I've seen firsthand in my practice over more than 15 years in clinical practice how these apparently small problems destroy men's confidence, rest, and quality of life. But, and I want you to listen to this very carefully, today we're going to put an end to that silent suffering. The solution is much more natural, practical, and less invasive than you've been led to believe. It's not just about medications, it's about a life strategy. I'm Dr. Evelyn Carter, and for more than 15 years, I've helped thousands of men find the truth and reclaim their lives, addressing the most taboo topics without shame and offering solutions that integrate the best of science with natural wisdom. It's a shame these topics aren't discussed more openly. I'd love to hear from you. Please tell me what country you're watching from right now. Leave me a comment. It's thanks to your participation, your courage to share your experiences, that this community continues growing day by day. Your voice matters a lot. Today we're going to talk about the power of something as simple as 1 glass a day. We're going to break down the potential of 5 types of infusions that, when used correctly, can work as an internal balm for your enlarged prostate. But before getting into those wonderful infusions, I need us to understand the root pain. The prostate, that small walnut-sized gland, has a vital function, but when it begins to grow, what we medically call benign prostatic hyperplasia, it becomes a jailer of your bladder. This growth is not cancer. It's important to make that clear. But the problem is that the prostate wraps around the urethra, the conduit through which urine exits. Imagine a garden hose being strangled by a fist. The water, the urine, struggles to get out. That struggle is what you feel as urgency, as dribbling, as the effort to start the stream. What in clinical terms we call nocturia when it's at night is the main destroyer of your sleep. In my practice, I see this problem daily. A patient I'll call for privacy. James, 68 years old from Chicago, confessed to me that he had stopped traveling with his wife because the anxiety of not finding a bathroom in time paralyzed him. His world had shrunk to the radius of his home and the places he knew well. This is what hyperplasia steals. It steals freedom, steals sleep, and steals dignity. Science tells us that about 50% of men over 50 years old have some evidence of benign prostatic hyperplasia. When we reach 80 years old, this percentage rises to about 90%. It's an almost universal condition for the aging man. The good news is that while it's almost inevitable, suffering is not. We can mitigate the symptoms with smart decisions, starting with what we drink. Let's talk about that 1 glass a day, that ritual, that infusion that can make the difference. We're going to focus on 5 types of infusions that have clinical evidence, or at least a solid traditional use history, backed by active components that attack inflammation and help modulate the hormone dihydrotestosterone, a key factor in prostate growth. The first is stinging nettle infusion, or Urtica dioica. Nettle root is without doubt one of the most studied natural remedies for the prostate. It contains compounds that interfere with the body's ability to produce dihydrotestosterone from testosterone, or at least prevent it from binding to prostate receptors. It also has mild diuretic properties that help empty the bladder, and most importantly, anti-inflammatory properties. Chronic inflammation is the silent engine of many health problems, and the prostate is no exception. A warm infusion of nettle root at night before bed can reduce the need to get up. The key here is the root, not just the leaf, because the concentration of key phytochemicals is higher in the root. 1 glass a day of this infusion can be your first line of natural defense. The second infusion is horsetail or Equisetum arvense. This plant is known for its exceptional diuretic effects, but here comes the clinical key. Unlike other diuretics that can be aggressive and unbalance your electrolytes, horsetail is rich in minerals, especially silica. Silica is vital for connective tissue, and in this context can help strengthen the bladder walls. When the prostate presses, the bladder works overtime. Horsetail helps make urination more effective. I'm recommending it as a daytime option to help you empty better during active hours and thus reduce the nighttime load, the nocturia. It's your morning glass a day, the one that prepares you for a day without constant urgencies. The third infusion is pumpkin seed or Cucurbita pepo. Although it's most common to consume the oil or whole seeds, a light infusion of crushed seeds can be very beneficial. Pumpkin seeds are an incredible source of zinc and phytosterols, especially beta-sitosterol. This is a compound that has been studied extensively for its ability to improve urinary flow and reduce the amount of residual urine remaining in the bladder. A man I'll call Michael, 73 years old from Boston, told me that just not feeling like urine was left in his bladder gave him back his sense of control. This is powerful psychologically and physically. Your daily glass of pumpkin seed infusion can be what gives you back that complete emptying sensation you miss so much. The fourth infusion is hibiscus flower, or Hibiscus sabdariffa. This flower, besides being delicious, has great anti-inflammatory and antioxidant power. It contains anthocyanins, which are pigments that give it that intense red color and combat oxidative stress. Oxidative stress, in simple terms, is the internal rust that accelerates the aging of your cells, including those of the prostate. Hibiscus flower infusion consumed cold or hot helps maintain cellular health and can be an excellent substitute for sugary drinks that only worsen systemic inflammation. We're using it here as general support for vascular and anti-inflammatory health, fundamental for any organ suffering a growth or inflammation process, like the prostate. It's your daily glass of cellular protection. And the fifth infusion is green tea or Camellia sinensis, but not just any green tea. We're talking about high-quality green tea, rich in catechins, especially epigallocatechin 3-gallet, or EGCG. EGCG is an extraordinary antioxidant with properties that have been studied in relation to cell growth modulation. In my clinical practice, I don't just recommend it for the prostate, but for health in general. Green tea can help reduce inflammation, and it's been suggested it may slow the progression of hyperplasia. The key with green tea is not drinking it too hot, letting it steep for about 3 minutes to maximize its benefits, and limiting consumption to morning or early afternoon, so as not to affect sleep due to its caffeine content. Your daily glass of green tea is your antioxidant shield, your daily cellular protection. Now, consumption. The dose I generally recommend is 1 glass a day of any of these infusions. This must be consistent. The problem with natural remedies is that many men try them for a week and give up. Nature works with consistency, not instant magic. You need to give the body time, at least 3 months of regular use for the phytochemicals to start doing their work. But the infusion isn't everything. The reason many men fail is that they make fundamental lifestyle errors that completely nullify the effect of any treatment, whether natural or pharmaceutical. I need us to talk bluntly about these errors because this is where most of my patients have found the true solution to their suffering. Let's talk about the 4 common errors that sabotage your prostate health. First error: uncontrolled nighttime fluid intake, especially coffee, alcohol, and beer. I've seen hundreds of cases where the man is taking his prostate medication, being diligent with treatment, but continues suffering severe nocturia. The cause isn't the medication, it's the habit. A patient I'll call Robert confessed to me that he loved having 2 beers while watching football before bed. Beer isn't just a liquid, it's a potent diuretic, which means it forces the kidneys to produce more urine. If you drink it at 10 at night, at 12, and 2 in the morning, you'll be forced to get up. Alcohol also relaxes the bladder's detrusor muscle and alters sleep quality, which is already fragile due to the prostate problem. The clinical correction is simple. You must ban liquids at least 3 or 4 hours before bed. This includes water, infusions, coffee, alcohol, and especially sugary drinks. If you're thirsty, wet your lips, but don't ingest more than 100 milliliters in that period. It's a small sacrifice in exchange for 6 or 7 hours of uninterrupted sleep. And coffee, which is a bladder irritant, must be limited to morning hours. This is a non-negotiable instruction to recover your sleep. Second error, excessive and chronic systemic inflammation due to diet. Many men associate prostate health only with going to the bathroom, but hyperplasia is a condition fed by inflammation. Abnormal cell growth is a response to a hostile internal environment. The error I see in my patients' diets is excessive consumption of refined sugars. Simple carbohydrates and trans fats present in fast food, ultra-processed foods, and sodas. These foods are highly pro-inflammatory. A patient I'll call David from Philadelphia confessed to me that his diet consisted of 50% white bread, pasta, and sodas. When we changed his diet, when he introduced more leafy green vegetables, oily fish rich in omega-3 fatty acids, which are anti-inflammatory, and almost completely eliminated sugar, his urinary symptoms improved noticeably even before we adjusted his medication. Systemic inflammation is like fertilizer for prostate growth. By reducing the fertilizer, you reduce the growth. The prostate is like a sentinel. If your body is inflamed, it will be too. And when inflamed, it presses the urethra more. Third error, prolonged sedentary lifestyle and central obesity. This error is one of the most insidious. The man who spends 8 to 10 hours a day sitting in front of a desk or on the couch isn't just accumulating fat. He's creating an unbalanced hormonal environment. Abdominal fat, what we call central obesity, isn't inert. It's an active endocrine gland that produces enzymes and hormones. A patient I'll call Thomas from Seattle came to me weighing 240 pounds with a waist circumference of 43 inches. This additional fat increases the conversion of testosterone into estrogens, and increased estrogens in older men is another factor that can stimulate prostate growth. Sedentary lifestyle also contributes to stagnation in the pelvic zone, worsening symptoms. I'm not asking you to run a marathon, but to move. A vigorous 30-minute walk a day, 5 days a week, can significantly reduce inflammatory markers and improve hormonal metabolism. It's a key piece, but most men dismiss it, thinking it's not directly related to the bladder. But believe me, your prostate health is your whole body's health. Fourth error, self-medication and lack of communication with the doctor. This is an error that can be dangerous. Benign prostatic hyperplasia can have symptoms that resemble those of other conditions, including urinary tract infections, bladder stones, or in the worst case, prostate cancer. I've had patients who have been taking natural treatments or over-the-counter medications for 1 or 2 years without proper evaluation. This is an error. A patient I'll call William came to me after having been taking an herbal mixture a friend recommended. His symptoms weren't improving. A simple prostate-specific antigen test and medical evaluation revealed that while he had hyperplasia, there was also a complication requiring specific management. The point is, there's no substitute for medical diagnosis. Treatment, whether natural or pharmaceutical, must be guided. Shame cannot be greater than your health. Talk to your doctor. Be honest about your symptoms. Men's health is a taboo we must break. Now that we've dismantled the errors, let's build the solutions. Life isn't just avoiding the bad, it's incorporating the good. I want to give you 4 practical tips that, together with the daily glass of whichever infusion you choose, will allow you to take control of your health. Let's talk about the 4 solutions and practical tips. First solution, bladder training and scheduled voiding. This is a practical and behavioral tip that works wonderfully, especially for urgency and frequency. The bladder, like any muscle, can be trained. When you feel urgency, the tendency is to run to the bathroom. But if you go every time you feel a small urge, you're training your bladder to ask you to go with less urine. This perpetuates the frequency cycle. The solution is scheduled voiding. Try to hold the urge to urinate for 5 or 10 minutes when you feel urgency for the first time. Do something that distracts you. This over time increases your bladder's functional capacity. Start by going to the bathroom every hour or every 2 hours and gradually extend the interval by 15 minutes. Over time, your bladder will get used to holding a larger volume before sounding the urgency alarm. It's a mental and physical process that gives you back control. Second solution, the color diet and the power of natural phytosterols. The principle is simple. If inflammation is the problem, natural anti-inflammatories are the solution. I've talked to you about infusions, but I need you to strengthen your diet with foods that fight inflammation and are rich in the same beneficial compounds the infusions have. We're talking about phytosterols, which are like plant cholesterol. These help inhibit prostate growth. Where do you find them? In the pumpkin seeds we already mentioned, but also in soy, corn oil, sesame oil, and wheat germ. You should also increase lycopene consumption. Lycopene is a carotenoid that gives tomatoes and watermelon their red color. Studies have shown that lycopene has a protective action on prostate tissue. And a crucial fact, lycopene is better absorbed when the tomato is cooked, for example, in a tomato sauce with a little olive oil. A diet rich in these elements combined with cruciferous vegetables like broccoli and cauliflower that help metabolize estrogens better is the most potent medicine you can consume. Third solution, mastering Kegel exercises for the pelvic floor. Many people think Kegel exercises are only for women. This is a huge mistake. Men also have a pelvic floor, and Kegel exercises are crucial for improving urinary function. The pelvic floor is a set of muscles that support the bladder and help control urine flow. When you have benign prostatic hyperplasia, the prostate obstructs the passage, and the pelvic floor muscles have to work harder. If these muscles are weak, post-void dribbling and urgency are worse. How to do them? It's simple. Squeeze the muscles you'd use to stop urine flow. Squeeze them for 5 seconds. Relax them for 5 seconds. Repeat this 10 times, 3 times a day. A patient I'll call Richard, 60 years old, told me that post-void dribbling was what embarrassed him most. After practicing Kegel for 6 weeks, the dribbling had almost completely disappeared. It's an invisible exercise you can do at your desk or while watching TV, and the benefit is huge. Fourth solution, managing anxiety and chronic stress. Chronic stress is an incredible exacerbating factor for hyperplasia symptoms. When you're anxious or stressed, your sympathetic nervous system, the fight or flight one, activates. This has several negative effects. It increases tension in the bladder neck and prostate smooth muscle. It's as if stress tightened that invisible fist around your urethra. Additionally, stress alters hormonal balance, increasing cortisol, which in turn feeds the systemic inflammation we've already discussed. The solution isn't a miracle. It's consistency with a practice that relaxes you. This can be meditation, deep breathing, or even a hobby that absorbs you. Deep breathing, for example, activates the parasympathetic nervous system, the rest and digest one, which relaxes smooth muscle. Just 5 minutes of deep breathing, inhale counting to 4, hold your breath counting to 4, exhale counting to 6, can change your body's chemistry, calm the bladder, and give your prostate a break. Silent suffering has lasted too long. I've given you the tools. The 5 infusions to attack inflammation from within. the exposure of the 4 errors you must correct immediately, and the 4 practical tips to regain control of your bladder and your life. You have the knowledge. There are no excuses to keep suffering in silence and letting such a small organ dictate the course of your rest and happiness. Change is a decision you make today. Start with that 1 glass a day and the liquid ban before bed. Give me a like, please, if this message has helped you. Share this video with other men you know are suffering in silence. Subscribe to the channel if you haven't yet, so this community of brave men keeps growing. And leave me your country in the comments. Thank you for your trust. It's an honor to be your doctor. I'm Dr. Evelyn Carter, and your prostate health begins with that 1 glass a day. See you soon.